Hi, Dr. Birchler from the Chiropractic Health Center. One scenario that we see come up very frequently in our practice is a person who has a number of different symptoms that really trace back to a problem in the neck, though they may be unaware of really what the problem is and not have a full diagnosis or evaluation of that problem. The symptoms are commonly pain in the neck, of course, but pain between the shoulder blades or around the shoulder blade, and that's this image shows that. That's why I have this image up here. I know it's a little bit difficult to see, but where somebody may have pain in the neck, but also chronic pain between their shoulder blades, possibly at the top of the shoulder blade or right at the bottom corner of the shoulder blade. Those are common, what's called referred pain patterns, commonly from disc problems in the lower neck, but the pain can often be more severe in the upper back or shoulder blade area even than in the neck. Now a person may also get shoulder pain. They may get pain in the chest, pec, breast, or collarbone area as well, which is also what's called referred pain, meaning there's nothing wrong in those areas, but they're experiencing pain in those areas because of the way the body's wired and or because of nerve compression that goes to those areas. Additionally, the person may have numbness or tingling that goes down into the arms, possibly to the hands or fingers, which is very common. And the reason that's the case is the nerves that come out of the lower neck. 3 nerves that come out of the lower neck, C6, 7, and 8, go all the way down and supply sensation to various sections of the hand and fingers. People with this type of problem also commonly have headaches, sometimes migraine headaches, which is very common. Sometimes they may kind of be tension headaches, like my shoulders and neck hurt, and then it turns into a headache. So a person may get headaches. And then vertigo is a little bit less common thing, but certainly is one of the things that can be caused from this as well. They may get some kind of unexplained dizziness or vertigo. It may or may not happen with the headaches and whatnot. Now, I have found that this type of problem often gets misdiagnosed or maybe not completely diagnosed. So a common scenario would be somebody has this kind of thing, and they get bad headaches with it or migraines, so they go to a doctor and they get diagnosed with migraines, which isn't necessarily a misdiagnosis, but then they get put on some kind of migraine medicine for that. If that problem is coming from a problem in the neck, in particular a herniation, a disc herniation or problem in the neck, while it may not be misdiagnosis, the physical source of the problem hasn't been identified, and then the person gets on medication and they don't really have treatment of the issue that's causing that. So a big cause for this kind of thing, especially if somebody has had previous treatment or good chiropractic care and it hasn't totally gotten better, there's commonly a significant disc issue or problem in the neck that may be affecting the spinal cord and or nerves that come out of the spine. Chiropractic is often very, very successful to help this kind of thing. So for somebody that's never had really good quality or maybe somewhat extensive chiropractic care, that is clearly the place to start with something like this. Now, if somebody does chiropractic care, and maybe people out watching this have had similar things, maybe they've done some chiropractic and it hasn't got totally better. A lot of times the reason for that is there may be a substantial either disc herniation or change in the spine and disc that have some bone spurs or things that are compressing or abutting or putting tension on the spinal cord. And so it might not just be a simple misalignment kind of thing. There may be more of a structural change that needs to be addressed. Now, some of those cases, I would say a lot or most of those cases, if we were to really be able to see what's going on in the spine and identify that, may respond well to mechanical disc decompression, which is a non-invasive way to take disc bulges that are hitting into the spinal cord or inside the neck there, and be able to draw that disc away and relieve that pressure without anything invasive. And to show you a couple MRI scenarios of this, this would be an MRI of somebody's neck, and these are the vertebrae and these are the discs, the black spaces there. This is kind of what a disc should look like, and then you see this black area sticking out between the discs, and this is the spinal cord coming down here, and it's causing the spinal cord to kind of bend or deviate, so there's pressure there. And a person may get a wide range of symptoms, all those things I described, possibly even other things where they get weird sensations in the chest or heart arrhythmias and all kinds of stuff that can happen with that. That can even cause symptoms down into the legs or feet, like numbness or tingling, even if there's nothing wrong with the low back or legs or feet. So these things can be it can seem like there's a lot of things going on, but if you really trace it back, the main problem is one area. Now, something like this would probably respond very well to mechanical disc decompression, because if you pull that disc away from the spinal cord or nerves, it can get a lot better. Now, some cases, you would see something like this, where here are the bones of the neck, and you see a big herniation in the neck, but it's kind of scissor pinching the spinal cord against the back of the spine, and so there's a compression of the neck. This is the kind of thing that would need to be evaluated or referred to a surgeon. And we see some of those from time to time, and that's a case where I can't, I'm not going to fix that or even try to fix that with what we do in those cases. They need to have an evaluation from a surgeon in those cases, because of the severity and the essence of getting that pressure off of that spinal cord quickly when there is true compression on it. If you were dealing with any of this kind of thing there, especially if you have not had chiropractic care in the past, or a thorough evaluation, or you feel like nobody's figuring things out, we'd be happy to talk with you, evaluate this, order any imaging to really see if there's a problem going on there, and then direct you from there.